Hello everyone, I am Dr. Gowtham, consultant cardiologist at Apollo BGS Mysore. So today I would like to talk on a very well-known topic and also commonly found, that is heart failure. So first of all, when we say heart failure, it doesn't mean that your heart has stopped working or has failed completely. So it means that the heart is not able to pump blood as effectively as it should have been. So in a very simple term, the pumping capacity of the heart has come down. So symptoms of the heart failure, as I said, the first and most common symptom is shortness of breath or difficulty in breathing. So it usually manifests as when one goes to sleep, they feel a tightness in the chest or shortness of breath that makes them to sit up in the midnight, and we call this symptom as paroxysmal nocturnal dyspnea, which is a very classical symptom of heart failure. So other than shortness of breath, the patient also tend to have excessive fatigue or tiredness, unable to do even routine daily activities, and other symptoms are accumulation of the fluid in the leg that leads to pedal edema or swelling of the leg. Also accumulation of the fluid in the abdomen called leads to abdominal distension, and also there will be irregular heartbeats, or we call it as palpitations. So these are some of the very common symptoms we see in heart failure patients. So the most common or important cause is actually coronary artery disease, or whenever there is blockage in the blood vessels that supply the heart. So this coronary heart disease leads to most commonly what we know is heart attack. So heart attack is one of the important cause of heart failure. So other causes include cardiomyopathies. It's a very large entity. So cardiomyopathies itself are sometimes cardiomyopathy is a process where the muscles of the heart gradually becomes weak and the pumping capacity comes down. So a large number of cardiomyopathies are caused because of the genetic defect, which are sometimes treatable and most of the time they are untreatable. So other causes also include heart failure include diabetes, hypertension, chronic kidney disease, and there are certain reversible causes like thyroid disorders, maybe hyperthyroidism or hypothyroidism, and also causes like excessive alcohol intake, smoking, and also most important, one of the common causes chemotherapeutic drugs, especially in the patients who are having cancer and are being treated by chemotherapy. So your doctor might diagnose heart failure first of all by doing a simple basic physical examination along with the history, what all I just said previously. So with the physical examination, next the doctor will ask for a few blood investigations, especially NT-proBNP levels. So next include ECG, 2D echocardiogram, and also in certain cases a cardiac MRI. Coming to the treatment option, we have to remember always the prevention is better than cure. So for the prevention of the heart failure, what we need to do is, one is first and foremost we have to follow a healthy lifestyle. So quit smoking, quit alcohol, exercise regularly, especially a graded exercise, and so next is actually having a healthy food habits. So that includes a lot of vegetables, green leafy vegetables, fruits, cut down on the meat, and also having a low salt intake. So especially in the patient who is having heart failure, so two things has to be kept in their diet. One is actually low fluid intake, and second is actually having a less amount of salt in their diet.